Okay, this video is to explain a concept called crowding out that not too many people seem to understand, especially in the wake of the public option. Everyone knows that the public option passed the House last night, which is essentially the only real hurdle it had left. The Democrats, I guarantee you, will ram this thing through, whether they have 60 votes in the Senate or not, which means it's effectively going to pass now. The only main hurdle that it had was the vote last night, and it passed 220 to 215. And, all the Democrats, liberals, socialists, whatever, different names for the same disease are all happy about this, and people like me, of course, are upset because we know what's coming. But I'm going to all the people that are celebrating it and that are complaining about people like me that are pissed and upset that it passed. I keep getting the same thing, that we're overreacting, and I'm the reason that you people are using is that the public option isn't taking over anything. The public option isn't going to force me to do anything. If I have private insurance, I can still keep it. No one's going to force me off my private insurance to get on this public option. Well, here's the concept that none of you people seem to understand, which I find hysterical. I guess no one takes economics anymore in high school or college or whatever. But this is the concept of crowding out. And this is also going to explain how the government pays for things. Because I don't know if people realize this. The government doesn't have anything whenever it does anything. It has to take from someone else and give to someone in order to do anything. Okay, and I don't know if people get that either, but and some people do, and they think it's fine. I call it stealing. They call it equality, which is just hysterical. But let me explain how the government is going to pay for the public option. It's going to pay three ways. Okay, number one, to artificially lower the cost and provide an affordable healthcare option, it's going to do three things. Number one, it's going to subsidize it through tax dollars. And this has already been stated, because people that can't afford any health insurance in this plan, whether public or private or whatever, are going to get subsidies through taxes to pay for health insurance. And this is going to come from people making $500,000 a year or more, and so those people's taxes are going to go up. And so number one, the government is going to tax. But here are the other two ways that I'm not sure people realize that the government can pay for things and artificially lower costs. The one way is what they already do in Medicare, and they simply don't pay doctors. Okay, the Medicare reimbursable rate for surgery is 65%. For every $100,000 an old person runs up in surgery, the government only pays $65,000 of it, and then the hospital will that same surgery the hospital will charge more for someone with private insurance. The $100,000 surgery will now become $130,000 or $140,000 to try to get some of that money back that they didn't get from the person who used Medicare. So the government can just pay doctors less, and they do this in Canada, and this is why Canada is having a massive doctor shortage. Okay, Canada does a number of other things. They're not training any doctors. They're cutting funding for training doctors in Canada, which is leading to a doctor shortage as well. But Canada doesn't reimburse their doctors very much for surgeries and medical care and that kind of shit, and so they're leaving a less incentive for doctors to enter the market. But the third way, of course, that the government can simply keep something going is what they do all the time, whether it's war, whether it's a welfare program, whether it's anything, is they can deficit spend. Everyone knows we have a $1.4 trillion deficit this year. We spent more than $1 trillion than we took in, but no one cares. That's all Bush's fault or whatever. I don't know the excuses people use, but regardless is that the government spent more money than it took in. So the government can do that, and that's something that a private business can't do. A private business can't just lose money, because there eventually comes a point when the bank will stop giving them a loan or whatever, where the business will have to go under because it's just not sustainable. The government can do that. The government can deficit spend to its heart's desire, and its credit with other nations, like China is buying so much of our debt right now, that credit can last a long time. So they can't deficit spend infinitely, but they can deficit spend for much longer time than a private business can. So this is three ways that the government is going to pay for the public option. But the purpose of this video is to explain crowding out, because not too many people understand what crowding out is, and this is how you don't have a choice with the public option. Okay, crowding out means the government will enter the free market and either take over a resource or a service that is being supplied by the private sector, and take those resources away and prevent the private sector from supplying it. And usually the easiest way the government can do that is it can tax something. When you take taxes away, it's less money people can invest in capital, the theory of capitalism, and the less money that they can make on said returns. So this is what crowding out means, is when the government dominates an area, it prevents the private industry from competing, which is why the public option, people say, oh, the public option will compete with these HMOs and it'll make things fair, it'll keep them, what is it, it'll keep them honest or whatever. No, it's not going to do any of that shit. Okay, the public option is going to crowd out private insurance, because this is what's going to happen. The public options, I don't know how much the insurance premiums are going to cost, but they're going to cost something like $100 or $120 a month, okay, to keep the cost lower than an HMO. So what's going to happen is that the theory is that HMOs are going to have to lower their healthcare costs, the price of their premiums, in order to pay to compete with this public option. Well, here's the thing. When people start flooding onto the public option and using it for every type of surgery, the really expensive shit, the not so expensive shit, the government is going to run out of money. But it can do a number of things. It can reimburse doctors less. It can deficit spend. It can raise taxes. It can do any type of thing to keep the program going, even if it's not making money. The post office is going to lose $9 billion this year, but the post office isn't going to go under. The government can keep it running no matter how much money it loses. Again, a private HMO cannot do that. When the HMO lowers its premiums from, say, $250 to $100, economics of scale is going to prevent it from making any profit, and eventually there's going to come a time, like I said, when the bank will stop giving it loans, or it can't make payroll for its employees, and the HMO will shut down. And then the people who were still paying on the HMO are going to have to go over to the public option and flood onto the public option, and this will happen more and more because the HMOs won't be able to compete, and then private insurance will seemingly end. And like I said, some socialists, liberals want this anyway. They want single-payer healthcare. And like I said, I predict that within 15 years of this bill being signed into law, we will have single-payer healthcare in the United States, for better or for worse, and of course worse. But this is what's going to happen in the private insurance industry, and this is what people don't understand. The people who say you have a choice, again, you don't have a choice. You have no choice, because the HMOs cannot artificially lower costs by deficit spending, by raising taxes, by paying doctors less. They can't do that, okay? In the real free market, you can't just make up money to pay for things like the government can. The government can do that, and that's why the government can provide everything cheaper. If the government wanted to, everything could be cheaper if the government supplied it, because it can do any one of those things. Raise taxes, deficit spend, whatever. Okay? Private businesses can't do that. If a private business makes no profit, it can do two things. It can run to the government for a bailout, like fucking GM has for the last 35 years, or it goes bankrupt. Okay? So those are the choices. But this is the concept of crowding out, and this is why I'm stating in this video that you don't have an option with the public option, and the public option will simply crowd out private insurance, and that we eventually won't have private insurance in this country, or at least not to an extent where it's really going to be competitive. It might be to the extent of like the public school system in America. In theory, nothing forces you to go to a public school, but there are so few charter schools and they're so damn expensive because they're not subsidized with tax dollars that there's really no competition for a public school. 99% of people will pick a public school just because it's cheap. Doesn't matter if it's good or not. So this is the purpose of this video, though, is that with the public option, you won't have a fucking option. So I'd say, again, don't fucking tell me that you have an option between the public option or private insurance. You don't have an option. Eventually, the private insurance will go out of business, which is pretty much the aim of the Obama administration, I'm convinced, because they have to realize this. And eventually, then that will lead the way for single-payer healthcare. So again, this is just the concept of crowding out for you people that don't fucking understand it, or don't even take the time to Google something to find out the definition of it. But this is why you don't have an option with the public option passing, the public option that passed last night, unfortunately for the future of the United States.